Give a big hand. I would like to call Srinivas Garu, a great well-wisher. I'll give you the profile details later. First, I would like to invite Srinivas Garu to the dais. And I would like to invite Sri Harikumar Garu, Dr. Harikumar, who happens to be our director of ACT now. And Swati Reddy Garu, where are you? Please come over the dais. Dr. Swati Reddy Garu is one of the honorary directors of ACT now. Give a big hand to her. I won't take much time of yours. First, I would like to appeal few requests to you. You being doctors, most unpredictable profession. When what sort of emergencies you get, even I think you don't know. So in such scenario, you will be getting some phone calls. I very humbly request you all, please attend the calls, but kindly go out. Because once you entertain a call, the other person will start. So ultimately, it will lead to disturbing the total scenario. Very humble request to you. Next thing is, there are a few doctors who has requested me that they have some few surgeries and medical emergencies, so they will be honored first. The program is very simple. First inaugural session, the guests will be speaking. After that, there will be awards distribution. Finally, vote of thanks. After that, you will be having lunch and go. This is the scenario. Now I'll take few words about my organization. ACT now is inaugurated by none other than Dr. APJ Abdul Kalam's elder brother's son, Dr. Ibrahim. He is the founder, chairman of International Global Abdul Kalam Foundation. So, right from day one, we believed and we used to talk about, do about, dream about Dr. Kalam's preachings. Conducting 50 major health camps is our biggest achievement in 4 years of our existence. These camps were, you might be seeing so many health camps. Normally it will be nothing but business givers to the corporate sector, but we never done health camps in that style. We asked the corporate and government sector hospitals to come with equipments and medicines. Means once a person comes to attend a health camp, he'll be getting all the tests done at absolutely free of cost. Then he'll be getting medicines also. In that way, one person minimum getting benefit of 10,000 rupees is what we aimed and we achieved. Such 50 major camps done by us, and great salute to the doctors fraternity. It is because of the doctors we could do such big marathon task. Now coming to doctors honoring, why doctors honoring? We firmly believe that doctors is a profession where one can save a fellow human being's life. No doubt on the borders, people are saving our lives. No doubt in our society, police people are doing a tremendous service. That's why law and order is under control and we are able to sleep happily. But a doctor is typically different. You go to a doctor with pain and he will relieve your pain and send you home with all smiles. That's why give a big hand to your doctors fraternity. One more thing I would like to tell you is you are all very fortunate. You are being honored with none other than Dr. APJ Abdul Kalam's name's award, the Missile Man of India, the People's President of India. Now, only health camps is not our cup of tea. We have distributed thousands of blankets and bed sheets to those people who don't afford a square meal, who don't afford a roof on their heads, who literally stay on the footpaths every year. Even next month, that is coming December, 30 days we will be continuously distributing free bed sheets and blankets to all the people who are staying on the footpaths in the freezing cold. You will be at your comfortable home with all blankets and bed sheets, but those people who are on the footpaths, this is our second achievement so far. Not less than 10,000 bed sheets and blankets were distributed. 50,000 people were fed at the COVID period. It is heartening to know many doctors have come to rescue of our burden. We could feed every day 300 people, and particularly 25 to 30,000 guest laborers on the highways. We made some shamiana, randomly cooking rice and making some dal into it. It was not a good, delicious food, but they were not even afford for that. They were eating it like biryani. So this was one phenomenal achievement. 50,000 people were fed by Act Now, and many doctors participated. I once again take the opportunity to show my gratitude to the doctors fraternity. Then finally, we selected few handicapped people, that is youth who are handicapped, who have so many dreams, but they can't move. So around 6.5 lakh worth of wheelchairs we have donated. This is one more feather in our cap. Finally, doctors honoring. At the time of COVID, I have observed, I have not told you, my apologies, I am senior journalist for the past 35 years in Telugu, print and electronic media. Being a journalist, social activist, and a central government advisory board member, I have observed that the doctors' fraternity is brutally attacked and miserably abused. So I approached IMA, Indian Medical Association. At that time, Dr. Vijayendra Reddy was the chairman. I told him, look, this is what happening. Can we do something? He said, what you want to do? We are also just like you, an NGO. Said, sir, we want to honor and make the significance of doctors felt by the fellow human being. They said, yes, we are with you. And that was the beginning. At that time, even I don't know that we'll be honoring few thousands of doctors in the very short period of 3 years. Yes, that was a phenomenal achievement. Again, this entire credit I would like to give the doctors. And doctors, you will be surprised to note not a single doctor was approached. Even you who are sitting here, I have not approached any doctor, because I firmly believe giving awards to a doctor is not a commercial thing to be marketed. So I used to ask doctors to refer. You are plenty of people sitting here has been kind enough to give me references. I used to refer. So and so Swati Reddy has given your number. Will you be interested to participate in our event? Then I would like to quote that there is many media houses like TV9, HMTV. There are many, Aaj Tak, NDTV. These are all are honoring doctors. I am really feeling jubilant to note that these many tycoons are honoring these days. But surprisingly, when COVID was there, no one honored, no doctor. It is only Act Now. Forget about Telangana. In India, we are the only organization honoring at the midst of COVID, honoring doctors. Those doctors who received honor from us used to suggest me, Dr. Murthy, you are going to face consequences. Don't do this. Very seriously, COVID is there. I used to tell them, sir, what I am doing is, if it is a right thing, the nature will cooperate, the Almighty will cooperate, and I am just like this. Before you, no COVID, nothing affected me. So these are few achievements of Act Now. We have few judges as our panel directors. Few IAS officers are our panel directors, and IMA National Secretary Sanjeev Singh Yadav is our executive chairman, and Indian Red Cross Society chairman Sri Ajay Mishra, senior IAS officer, is our honorary chairman. Why all these people come? Because Act Now doesn't do anything hanky-panky. It does the social welfare activities. They believe, and we are living up to their expectations. With these few words, I take your leave and very humbly request Sri, first who it is, Dr. Srinivas Garu's profile is too big here, but I won't take much time of it, but I'll ask him to say a few words. He is Dr. Srinivas, Dean, the College of Family Physicians of India, give a big hand, and consultant family physicians, Lakshmi Das Memorial Organization. So with these words, I'll request Dr. Srinivas Garu to address the gathering.
To this sort of awards and actually one of our Academy of Family Physicians of India treasurer, she has invited me to receive this award. I was very much inspired because as you all know, Abdul Kalam is a great leader and a great academician, great scientist with so many capabilities, and immediately I accepted. I felt that it is a great honor to me. And ours is a growing specialty, the family medicine, which has been ignored all the time. And it is just like it is growing now. We have MD family medicine programs, DNB family medicine programs. I worked in Apollo Jubilee Hills, Apollo Hospital Jubilee Hills for 10 years and worked as HOD of Department of Family Medicine. And we have several programs. Common is also having DNB programs. Such an encouragement. And one thing, we conducted a national conference, national conference on family medicine primary care in Hyderabad in 2022 April, in the midst of the pandemic. That is in the midst of third wave. Pandemic was not over. And our theme was post-COVID strategies, strengthening primary care and public health in India. It was a very huge response. And we discussed the pandemic, how to put an end to the pandemic. And we discussed some important documents of the WHO. One important document, make it the last pandemic. We can prevent the pandemics. If we have a zeal and if we have a scientific outlook, we can prevent the pandemic. Let it be the last pandemic. That was the WHO slogan, and WHO document was there. And we discussed how important is the primary care and public health in India. And I hope that all our colleagues and they will know the significance of primary care. Primary care is the need of the hour. 90%, 60%, 96% of the cases can be dealt at the primary care level. So with these few words, I thank the organizers for giving me this opportunity to talk to you few words. Thank you, sir.
Thank you. Now I'll invite Dr. Hari, because Hari is not only our honorary director, a very good friend of mine, close to my heart. And we normally start with his little session, very little time, but mind-blowing session I will call, making people to smile. What else can we expect from the fellow human being? Cherishing the smiles, heartful smiles. Welcome Dr. Hari to come over here. Thank you.
Thank you, sir, for your nice introduction. Abdul Kalam ji beautifully says, my creative potential unleashed, not in busy mind, but blissful mind. He also said, when your signature becomes autograph, like what we prescribe during a patient prescription, it becomes a true success and also great help for the patient. Third thing, most important thing is, I am not handsome, but I can give hand to someone who are in need. These are all applicable more to the doctors. So I think he has a doctor heart. Okay? With this, all of you keep your hands like this. Most of the time, we react according to the situation. But Abdul Kalam said, respond to the situation. The responsibility comes from respond. When I say 1 to 5, you have to clap. Let us all, because some of the few friends are here. For them, 1, 2, 3. I said, why you clapped for 3? We are all very, very intelligent people. Studied MBBS, MS General Surgery, MCH Plastic. Why? Why we are unable to? Tell me the reason. Because you followed. Because I am also professional like you. You felt you had to follow. But Abdul Kalam ji beautifully said, you have your own unique potential. Follow your heart. Never be misled by the other people. We live according to the others' expectations, comparisons. And at the end we feel that we have not lived our life. All of you keep your hands like this. This one in upward direction. Yes. Downward direction. Yes, we can do the opposite action. That's why man is called, or human is called multitasker. That too, doctors are very, very great people. Claps to doctors. Now keep your hands. Let us check our multitasking potential. Do this in forward direction. This one in backward direction. Do it simultaneously. We think that we can control our wives, our society. Our 2 fingers are not listening our mind, our command. From this we have to understand some of the things are not in our hands. That's why Abdul Kalam beautifully said, it is not the independence, interdependence is most required for the humans. As an evolved person, we should always respect others, identify the uniqueness of the people. And finally, he said, my total power unleashed by meeting the gurus. It is not doing prayer or yajna or something else. I silently listened to the gurus. That made me a guru of the whole world. Inner world, not our outer world. So, I'll teach or I'll share with you a simple method by which many of our legends have enjoyed their life. It is not becoming example for others, but enjoying our own life is possible. Why? Because we think that we are limited to the body. We are body alone. But during sleep we realized there is also some other world. And also realized when we are in ICU, whatever we lived is not at all the life. Something other life is also there. So, it is our scientific temper. Why? Because what is the difference between religion and science? Science is a questioning. Okay? With this, keep all of your hands like this. Please follow for 1 minute. Fifth one, long breath. Start with smile on your face. No income tax paying face. 4 times short breaths. 5th long breaths for 1 minute. Anything which is done collectively synergizes with closed eyes. We'll live heartfully now, soulfully now. 4 times short breaths, 5th long breaths. Breath and mind are interlinked. Breath mastery is life mastery. 4 times short breaths, 5th long breaths. Sound must come. Others must think something is going on here. 4 times short breaths, 5th long breaths for our sound body and sound mind. 1 minute over, another 1 minute. for our own health, for our own happiness. 4 times short breaths, 5th long breaths. No prayer, no chanting of mantra, only breath walk. 4 times short breaths, 5th long breaths. It is not religious. As you are breathing, your whole body is becoming very, very, very light. Last 30 seconds. Breath connects inner and outer worlds. Breath is the bridge between body, mind and soul. Now take long breaths, keeping hands in Namaskaram position. Take long breaths for long life. You have great power, great energy. Doctors are very, very compassionate beings, lovable beings, unconditionally. Doctors are very, very positive beings, always finds wellness in illness, gain in pain. బాధలో భగవంతుణ్ణి చూసేటువంటి వారు వైద్యులు, నొప్పిలో నిర్వాణాన్ని, కష్టంలో కైవల్యాన్ని చూసేటువంటి వారు వైద్యులు. వైద్యో నారాయణో హరిహి. లాస్ట్ 10 seconds. Long breathings, as if whole body is breathing, every cell is breathing. Mental wellness is the root, physical well-being is the fruit. Now observe your normal breath, normal, natural, easy, soft breath observation. As you are observing the breath, the smile on your face is spreading all over the face, all over the body. Every cell is smiling. Every organ is soulfully smiling. Whole body becoming light. Spread the smiles into high-tech's auditorium. Abdul Kalam Medical Excellence Award event. Spread the smiles into this auditorium, into Madhapur, and whole Telangana is smiling soulfully because of our synergy. Spread the smiles into whole globe. Now bless your body from this expanded state of consciousness. Bless your family. Bless all the health seekers, our teachers, professors, deceased, COVID warriors, and slowly, slowly keep palms over your eyes. Slowly, slowly open your eyes. 5, 4, 3, yes, 2, 1, 0. With big round of applause to act now. How many of you felt good? Raise your right hand. Very simple exercise. We can share this to our nurses, our patients, so that nobody will claim, nobody will comment on the doctors, criticize the doctors, because they can understand the pain of the doctors, the seriousness of the doctors in the waiting hall. With this, thank you very much. Mental wellness is the root, physical well-being is the fruit. Thank you.
Thank you, Dr. Hari. As usual, it was very hilarious, very knowledge-based, and thank you so much. Now, I would like to invite Dr. Swati Reddy, as she is the having a fellowship in diabetology, fellowship in medical law, Managing Director of Suvidha Hospital and Rehabilitation Center. Moreover, she is the greatest well-wisher of ACNO, a good friend of mine, and our honorary director. With due respect, ma'am, I invite you to hear. Thank you. Give a big hand to Dr. Swati Reddy.
Good morning, everyone. I think there's no energy over here. Even after Dr. Harikumar's blissful smile, we don't have smiles here. Yes or no? A big smile? Okay. So, first of all, I want to thank ACNO organization and KS Murthy garu. I have to say, a great human being who has not only taken care of, so many charity works, non-profitable things. So he has taken care of the physically handicapped people. And after my association for 1.5 years right now, I have seen him doing lot of charities. So last year we have participated in the biggest medical camps he has organized. I have never seen such a beautiful medical camp. Like so many people, so many doctors coming forward. So this all shows that humanity is still there. So even doctors want to serve. So nowadays where people are thinking that doctors are only earning and not doing any humanity services, so this camps will prove it wrong. So, and not only that, supplying bed sheets and giving that simple things which are needed for life. So noticing that simple requirements of people and honoring people is a great thing. And I really appreciate KS Murthy garu for this wonderful thought. And the way he is really, he has that urge, in fact, that he has to honor a lot of people who are doing services. And he has chosen this doctors category for it. And right from really, whatever that during COVID times, I feel that doctors were cornered somewhere. No, people were not giving us that respect or whatever. But these people, so they have, continued that honorary, continued that recognition and appreciation to the doctors. So continuing from there, and I have seen lot of award functions wherein people were asking for more of money, people were asking for fame, or there were different categories they choose for giving awards. But here I have seen that it is truly like a wave. Like one doctor recognizes a few people and those people are honored. And that person again recognizes a few really requiring people and those people are honored. It is just a ripple of wave. There is no partiality or there is no, no personal benefit seeking in this. So I truly appreciate that. And thank you for sharing stage with so many honoraries over here. Thank you each and one. And thank you, Murthy garu. And congratulations to all the awardees.
Thank you so much. A disguised boon for us is Dr. Swati Reddy. Whenever we call, whenever we have anything, she'll be there. She is very kind and always appreciating and motivating us. Thank you so much, ma'am. Now, I would like to call, before that, I would like to tell you, everyone, I should say, they were enhancing the worth of smiles. There is one greatest humorist called Om Vyas. He said, have you ever seen a donkey smiling? Have you ever seen? No, only a man can smile. If the donkey is trying to smile, that means he is trying to be a human being. And if someone is not smiling, rest you understand. Well, I would like to take the opportunity to introduce Dr. Suresh Kumar Garu. He is working in RVM Medical College. He is MD Pediatric, DCH, FRCP-CH, UK, and former Professor of Pediatrics and Neonatology, Usmania Medical College, Superintendent of Nilofer Hospital, With due respect, I take the opportunity to invite him to say a few words. Dr. Suresh Kumar Garu.
Dr. Murthy Garu, and dignitaries on the dais and off the dais, and today's awardees. It's my pleasure to be here as guest of honor. I told Dr. Murthy Garu I'll just come as an awardee. So I said, no, you have to come and then stage dais with the other dignitaries. So sorry for being late because I was held up in one conference. I was chairing one session. So that's why I told him I'll come a bit late. Thank you for giving us this opportunity. I appreciate the work done by Dr. Murthy Garu, as you heard from Dr. Swati Reddy. He has been contact me for last 4 or 5 years. Unfortunately, I could not come. Now I thought I cannot delay anymore. So I accepted. Thank you, Dr. Murthy Garu, for wonderful gesture. And I would like to congratulate all the awardees and all the people who have gathered here and appreciate the work done by Dr. Murthy and others as a team. Thank you, Vananda.
Excellent. That was, I believe, very crisp, short, and sweetest. Thank you so much, Dr. Garu. Now, before I call the chief guest of today, I would like to introduce him to you. I would say a lion-hearted man. Sitting between us, an elderly person with, Gambhiranga Lerayana. See, we heard a lot of things about Pakistan's terrorism, counter-terrorism, being, army people are being bashed by our own people in Jammu and Kashmir. These are all things we have seen in TVs, we have seen in newspapers. But a man who faced it physically present there, what may be the heart may be. For that heart, that great son of earth and son of India, give a big hand to our chief guest, Rajendra Kumar Garu. I have seen, being a journalist for the 3.5 decades, I have seen enough DGPs and IGs and IPSs. But somebody coming from that place, automatically I feel, in fact, I first asked him to be a guest of honor. My dear friend Hari has suggested. After seeing his profile, I said, boss, he is not fit for guest of honor. He should be the chief guest. A person who is being honored with so many national and international awards, UNESCO itself, and he has accepted to be a guest of honor. That is the greatest kind gesture, sir, with due respect. Then today morning, he don't know that he is being noted as chief guest. In the morning, when he said, I'll be there. Who is the chief guest? I said, sir, you are the chief guest. But you said I am the guest of honor. But your profile is such, I could not, it is unrestricted. I could not resist myself. So I invite you as a chief guest. Meticulously, which I, being a journalist, I observed, he said, I'll be there by 10:28. Will you believe? When I invited people, still people are coming, you can see. Whereas he, being the chief guest, I said 10:30 and 10:28 sharp. I greeted him outside and I said, boss, we have to learn a lot of things with this man. He is living legend. With these few words, sir, I can go on saying about you. The time not permitting me. With due respect, I invite you to say a few words and honor us.
Thank you very much, Andy, Dr. Garu. It's very, very kind of you to invite me to be with you. And as a policeman, I am least qualified to address the doctors. After what all he has said. Having said that, I think I am the only qualified person to describe or to speak about what doctors have done to me. I don't think any one of you has spent as much time as I spent in an ICU How many of you have spent your time in ICU bed? Hardly anyone. Imagine a situation, half a dozen AK-47 bullets from a 50-yard distance shot at you, close quarter, in a suicide attack. You are hit, your femoral bone is shattered, your femoral artery is shattered, right? By the time you reach hospital, your pulse is hardly felt. That was the position on May 21st, 2006 in my case. Badly shot, injured, rescued by my gunmen, taken to the first hospital close by in Srinagar. I'm talking about in Srinagar, as a police chief at that point of time. There they have done the basics, then they said no, he has to be taken to there is one Sher Kashmir Institute of Medical Sciences. It is patterned on AIMS. The doctors are the best, simply. They are all local doctors. Now, that was the portion they have recorded. Pulse hardly felt, total loss of blood. It happened around 12:30 in the afternoon. By the time I reached the second hospital, the final one, it was around 6 in the evening. 5 days there, a couple of attacks were made on the hospital by the terrorists to get at me. Then the government decided to airlift me, to shift me to, initially they thought of sending me to AIMS Delhi. In fact, the doctors from AIMS were also flown to Srinagar to see me and to advise the local doctors there. They said what the local doctors have done was perfect. Then subsequently, when they asked my wife, my brother-in-law, who is a doctor here, he also flew down to Srinagar. Then they said, okay, then instead of going to Chandigarh or Delhi, Hyderabad has better facilities and the emotional backup support would be there. Whereas I had my full confidence in the doctors who were treating me there. The organizational backup was there. Everything was available. It was just 2 days before the Prime Minister's visit to Srinagar. This has happened. Well, then I've been shifted here to Hyderabad. Came to care by air ambulance. But the doctors, when I landed up here, the doctors, I could not believe. They had to open my leg once again. Initial understanding was they may have to amputate my right leg below the knee. They were not sure about the vascular surgery. They have to take a vein from this leg, from my left leg. I believe they have reversed it, put it on my, grafted it into my femoral artery. They restored the blood supply in time. And that's how the leg, it's not only the life, the limb was also saved. The doctors still here, they couldn't believe. They opened, they saw it's perfect. Now comes the reunion of the shattered femoral bones. Both of them were literally dead, both the sides, and there was about 10 mm gap where the splitters have gone. Now that they need to fill up. It took another half a dozen surgeries by Dr. B.N. Prasad, if you know him, the orthopedic surgeon. He was also the fastest surgeon even for the Dr. APJ Abdul Kalam. He and his team of doctors, I would say they performed a miracle. 6 months was the time I was on bed. They made me walk. They did all the surgeries. They did their best. However, when I kept on questioning various things, they didn't have a lot of answers to my questions. So they gave me all the orthopedic books. So I become a part orthopedician now. Then one humble answer from the doctors was, finally when I got fine, within 1 year again I put on my uniform, back into action, and I started from where I fell. So this right leg, you can see it, not a centimeter of difference. This completely reconstructed this leg. Lot of debridement, lot of muscle has been lost. So doctors' humble answer was, we did nothing, we just joined them and we left it to God. It's a God who has cured it. That's the humbleness of doctors. None of them claimed. None of them said, oh, we did this, we did falana. They said, no, we just did whatever was required to be done, and then it's a God. Now those doctors are my best friends. Having said that, now of course we're talking about, it's really a great occasion to honor you all. I deem it as my honor on the birth anniversary occasion of Dr. APJ Abdul Kalam. I don't know how many of you have met him. I met him personally on more than 2-3 occasions. As the President of India, he was visiting J&K, he was visiting Kashmir as the police chief, local police chief. I handled him, a very, very simple man. In fact, for the corporates and others, people who are making money, not for the normal doctor, but those corporates, those hospitals who were making money, he would be seen as a culprit. Because he has come out with a stunt which used to cost lakhs of rupees. He along with Dr. Somaraju, they have come with Kalam Somaraju stunt. And Zoom has come down the cost of the surgery and the stunt. It has come from I think 2 lakhs, 20 lakhs, 2 lakhs to 3 lakhs, it has come down to 20,000, 40, 50,000 to 20,000 now. That's what this great person has done. So I had the opportunity, I was fortunate enough to meet him in flesh and blood. Maybe another 50 years or 100 years down the line, people may start wondering whether such a man ever existed. Like Einstein said about Gandhi, he said, I wonder whether this man by name Gandhi has ever walked in flesh and blood on this earth. I think similar thing, I'm sure, people would talk about Dr. APJ Abdul Kalam. Now, gentlemen, thank you so much for giving me an opportunity, for inviting me to be here. It's a real privilege to be interacting with all of you. And my best wishes and my congratulations to all the doctors who have been awarded this. And let me also tell you, as the CEO, I'm also the Chief Executive Officer of Entire Memorial Trust. We also do similar things what doctor does. We operate in the fields of education, health, then providing safe drinking water, then employment, livelihood, and disaster response and relief. We have intervened in all these situations. One small example, from the trust side, we have conducted so far more than 8,000 medical camps and a database of 19 lakh beneficiaries is with us. Every month, we organize minimum 15 medical camps at one place or other. So I'm glad, I never knew about ACT now. Yes, for the first time I heard you have done such a good job. And similar thing we have done, the doctors are so selfless. Like I said, if 19 lakh beneficiaries are there, we got doctors free of cost. They came voluntarily and they helped us out. And only small little things, disposables, we were providing, otherwise doctors came and worked voluntarily with us. And during COVID again, we have seen we organized a lot of telemedicine. He has worked physically. We could organize a lot of telemedicine and teleconsultations, even the doctors who were stationed abroad. We used to get them early in the morning. We used to organize teleconference, patch up using technology, patch on to the patients, get to talk to them, give them that confidence. There are a lot many things, of course. Now, anyway, it is his day today. I would not be talking about the one which I am doing. And you're doing a wonderful job. We are with you anytime. Feel free to get in touch with us. We'll work together. Thank you. All the best. Thank you, everyone.
Thank you very much, sir. Most inspiring. I would say he is very young, younger than all of us. Have any doubt? What an energy, Sarji. Fantastic. With a pot belly, I won't say. I feel. I'm ashamed. What is this? He is.
My day starts at 4:30 in the morning.
So that is the. You have given a lot of energy to us, sir, physically as well as morally. Fantastic. And I want to warn you all doctors. Very serious warning. I'm observing the claps are very weak. And mind you, if you don't clap properly, when you come and get award, I'll see that nobody claps for you. Now, show your energy after seeing our most beloved Rajendra Garu. Give a big hand. You feel it is little sound, sir? Not up to mark?
Doctors are very, very gentle people.
Oh. Give a big hand, please. So, it is very pleasant. Once again, I take this opportunity to thank all the gentlemen on the dais. At the same time, you people are blessed ones. Please understand this. You people are not common people. You are all blessed people. It will be too much or exaggerating to say demigods, but I don't have any objections to say. I'm not some LA player, I'm well-educated person. So I'm saying this, you people are really blessed ones. Feel proud of it. There are people, any department in the whole country, some black sheep will be there. Even in doctors are there. But what randomly we have to think, the majority of the noble things done by doctors. And I salute you all. Be happy. You are being honored with none other than the people's president and the missile man and a notoriously medical person. I can say you have given a splendid example of Somaraju and Dr. Kalam's stint. So give a big hand to all you, and mind you, this week claps I will never accept. I'll certainly see that when you come, no claps are there. Prove yourself. Give a big hand. Now we'll honor the people on the dais, and next your awards will be given. It is your day. Sure, take care. So it is your day. You are being honored. Leave it here. Take care. So these are honoring days for you. So be comfortable, be patient, and be cheerful. Not that every day you will be called with Dr. APJ Abdul Kalam's awards, right? So be cheerful and don't keep faces by seeing I get low BP. Please don't do that. Like this you be. And somebody, most preferably Dr. Hari said, we don't know about wives. We can't control wives. Wrong it is. There are 3 types of wives in the world. Please mind, it is not said by me, some intelligent man said. And you ladies, don't behind of me after going out, kindly save me. The 3 kinds of wives is, one is, they are like Mother Teresa. You shout at them, they smile at you. You get irritated, they'll console you. They are like. The other ones, they'll be okay, they'll ignore. Okay, they're not there. Finally, the ones, he said, we have. At least hold it. This is something. I'm honored, greatest honor. Give a big hand here.
దీనిపైన పూల మాల వచ్చినప్పుడు చాలా బాగుంటుంది సార్.
కానీ మాల తిరస్కరించి
అభినందన మాల Big round of applause. Big round of applause to Action.
Dr. Anirudh? Yeah, please come. Start clapping here. Most handsome man, Anirudh.
Thank this organization Act Now for honoring me and recognizing my skills and contribution to the medical field. Thank you so much. Thank you all.
ఇట్లా ఉంటే ఎక్కువ క్లాప్స్ కొట్టాలి, తక్కువ మాట్లాడిన వాళ్ళకి. థ్యాంక్ యూ. ప్రీతి అమ్మ, ప్లీజ్ కమ్.
Good morning, everyone. First of all, thank you so much for inviting me here and honoring this award. Thank you, Murthy sir, and thank you all of you. I'm Dr. Preeti S. Raga. I'm professor and HOD of Department of Otorhinolaryngology, and I'm working in the Kamineni Institute of Medical Sciences, Narketpalli.
డాక్టర్ రేఖ ఉన్నారా?
Good morning, everyone. I'm Dr. Rekha. So, thank you for inviting me here, and congratulations to all the awards.
People are hesitating. Some people are saying no problem. Please don't think for speaking also you will be paid. No. So in spite of it, you should speak 1 minute or less than that. May I invite Dr. Vallur Sujata Reddy. Vallur. చూస్తుంటే ఇట్లాంటి డాక్టర్స్ ఉండాలి ఇంట్లో అనిపిస్తుంది. That's why, sir. I don't have, that's why I'm free.
Good morning all. I'm Dr. Sujita. I'm consultant ENT and cochlear implant surgeon from my hospitals, Jubilee Hills. So I'm very thankful and to Act Now and team for giving this award, and sure this inspires me and helps me to contribute more towards society. Thank you all.
Thank you. Thank you very much. So sweet. Now may I invite Dr. Sirish Reddy.
Sirish, working as neurosurgeon at Global Hospital, Lagadi Kapul. I'm very thankful for the ACNO organization for giving me this honor, and it is a very encouragement to serve more. Thank you very much.
Thank you, sir. Now, may I call Dr. Jagdish Chandra Garu, Senior Consultant. Please. Madam.
Very good morning or good afternoon, I should say. Thank you very much, Mr. Srinivas Garu, for Dr. Srinivas Garu, for honoring me. As a matter of fact, I didn't know about the act at all earlier. And when you called up and then you said that Dr. Suresh had referred my name to you, that was the reason. And then APJ Abdul Kalam, that name itself was an inspiration. I have met him, but when you said that I was going to get this award, APJ Abdul Kalam Award, I thought it is my duty to take up it. And as far as I'm concerned, I've been in the field of pediatrics and neonatology for more than about 40 years. And we have been doing a lot of work along with Suresh and myself. And I've been fortunate to be a national coordinator, one of the biggest programs in India, which was training newborns all over the country. So fortunately, I was very fortunate to be nominated over there. Thank you very much. I think I'll continue this work, and it's an inspiration. Thank you so much.
Thank you very much, sir. స్నేహలత గారు ఉన్నారా? ఫ్రంట్లోనే ఉన్నారు. వెరీ గుడ్.
Thank you, ACNO, and for inviting me and for giving me this award. It truly inspires me to work more. Thank you.
Extraordinary. Thank you very much. And I should thank Dr. Jagdish Garu because he addressed me as Srinivas Garu. Thank you very much, sir. Dr. Aruna Garu Komineni.
Good morning all, I am Dr. Aruna, Consultant ENT Surgeon and Allergy Specialist at PRK Hospitals, Chandanagar. And I thank Dr. Murthy sir for giving me this opportunity for honoring and taking this award. Thank you.
Thank you very much. See, there is a saying about ENT. You know, చెవిటోళ్ళు ఇద్దరు మాట్లాడుకుంటున్నారు. ఎక్కడికి వెళుతున్నావు అని అడగాలి కదా. అడగటమే బజార్కి వెళుతున్నావా? అబ్బే లేదు బజార్కి వెళుతున్నా. ఓహో బజార్కేమో అనుకున్నా. దట్ ఈస్ ద సిగ్నిఫికెన్స్ ఆఫ్ ఈఎన్టీ. అర్థం కాకపోతే నేనేం చేయాలి? డాక్టర్ షాజియా.
Hello, good morning, one and all. My name is Dr. Shazia Farhana. I'm a consultant physician and diabetologist at PRK Hospitals, Chandanagar. And I feel it is a very honorable and thank you for giving me this opportunity. And it will be like encouraging for all the doctors. Thank you.
Next, may I call Dr. Sudha Rani Garu. Where I stay, sir. Very near to you.
Good afternoon, everyone. Reverend dignitaries, seniors, and fellow doctors. I'm happy to be here today, and appreciation always motivates us. So, thanks for appreciating our work and listening to the inspiring stories from Sir and making us smile. Yeah, soulfully smiling. And this is really happy occasion for me. I'm a Dr. Sudharani. I'm a radiologist. I'm running a diagnostic center at Kompally. And thank you.
Best wishes to the doctor.
Thank you very much. Dr. S.S. Karthik.
Good afternoon, everyone. I am Dr. S.S. Karthik, orthopedic surgeon from Apollo Jubilee Hills. Thank you, Hacknell. Thank you, sir. Thank you, everyone, for this award, and congratulations to all.
Thank you very much, sir. Dr. Praneeth Reddy.
Good afternoon, all. Myself, Dr. Praneeth Reddy. I'm a consultant orthopedic surgeon at Apollo Hospitals, Jubilee Hills. And I thank the Murthy Garu and ACNO for giving this. And this award inspires me and also increases my responsibility towards my profession. Thank you.
Separately, I know Praneeth. Separately, I know Swati. But today, I come to know something else. Thank you. Dr. Janaki.
Good afternoon, everyone. I'm Dr. Janaki, gynecologist, and I really feel happy and pleasure to take this award. And thank you, Murthy sir. And this will really inspire our young doctors to achieve more and serve more to the society. Thank you.
Thank you very much. Who is the next? Dr. Sahiti Balmuru.
Good afternoon, everyone. I'm Dr. Sahiti Balmuri. I'm an obstetrician gynecologist associated with KIMS Cuddles, Gachibowli. I aim at women empowerment, and I believe that women should be completely responsible for their health and take their decisions by themselves. Thank you, ACNOW and Murthy Garu, for recognizing my work, and this definitely increases my responsibility in serving the society better. Thank you so much.
Thank you. May I call Shalini Reddy Garu?
అందరికీ నమస్కారం. నా పేరు డాక్టర్ శాలిని రెడ్డి. నేను కన్సల్టెంట్ పీడియాట్రిక్ ఇంటెన్సివిస్ట్ at Amkura Hospitals, LB Nagar. I'm thankful to all the dignitaries over the stage and the ACNO organization for honoring me with this award. I think this is the inspiration for all the youngsters and upcoming doctors towards the occupation as well as towards the service and mankind. Thank you so much.
Thanks, ma. Nivalika Rajamoni.
Thank you very much.
So kind of
Give a big hand to our Rajendra sir. Thank you.
My apologies. I have a pressing commitment at 12 o'clock. So I beg your leave. I got to.
Thank you so much, sir. Honored. Thank you so much.
Good afternoon, everyone. I am Dr. Nivalika, consultant oncologist, Yashoda Malakpet. I am thankful to Act Now organization and KS Murthy sir for their service towards the society, and I am also thankful to Almighty for giving me this opportunity. Thank you.
Thank you so much, ma. May I call Dr. Mohammad Abdul Azim. Yasin Fatima.
Good afternoon, everyone. I am Dr. Mohammad Abdul Azim. I am working as a consultant radiation oncologist, Yashoda Hospital, Malakpet. I thank ACNO and Murthy Garu for inviting me and giving this award. Thank you, sir.
Good afternoon, everyone. I am Dr. Yasin Fatima, working as an assistant professor of anesthesiology at Usmania General Hospital, Medical College. And thank you, sir. Thank you, everyone, for giving this opportunity. Thank you.
Thank you very much. May I call Vivek Babu? Dr. Khalil M. Ali Khan. Be there, sir. One second.
Thank you, sir. Thank you, Murthy Garu and Act Now for giving me this award. I am Dr. Vivek. I am a cardiac surgeon at Village Hospitals.
Khalil, आप आइए. Shazia, you too.
Good afternoon, everybody.
Even there, if she is, you are able to speak.
Good afternoon, everybody. I'm Dr. Khalil, radiation oncologist, consultant in SLG Hospital. So I thank Dr. Murthy Garu for inviting us and honoring us in this award. It is very encouraging and it instilling a great confidence in us. Thank you, sir.
Thank you very much. Most beautiful couple, give a big hand. Next, please. Dr. Raviteja Buddha.
I'm Dr. Raviteja, consultant interventional pulmonologist at Virinchi Hospitals. Thank you, Murthy sir, for giving me such an opportunity. I would like to say one word from now onwards. If you do any camp, I'm ready. I'll be there for you.
Thank you.
Anytime.
Give a big hand, please. Thank you very much. So kind of you. Thank you. Dr. Murahari, on behalf of Dr. Murahari, there is one Narahari, is there? Yeah, please. Like to say something on behalf of your brother? Dr. Nagur Garu. Wow, grandfather and father.
Good afternoon all. I am Dr. Nagur, interventional cardiologist in PRK Hospital, Chandanagar. Thanks to Act Now and thanks to Murthy sir. Thanks to my PRK colleagues.
Thank you very much. Naresh Garu.
Good afternoon, all of you. Myself, Dr. Naresh, consultant critical care medicine at Medicover Hospital, High-Tech City. I would like to thank ACT organization and Dr. Murthy Garu for inviting me and honoring with this prestigious award. Thank you. Thank you once again.
So sweet. Thank you so much. Dr. Anil Mannava.
Hello everyone, I am Dr. Anil Kumar Manwa, consultant gastroenterologist in Yashoda Secunderabad and Elite Gastro and Liver Clinic, Srinagar Colony. I thank Act Now organizers, especially Murthy Garu, for recognizing and encouraging the doctors. I am happy for this. Thank you.
Dr. Nikhil Bhargava.
Good afternoon. I'm Dr. Nikhil, Consultant Emergency Medicine, Citizens Hospital. And thank you, Murthy sir, and thank you, Act Now, for this wonderful award. And we'll strive to work harder and get even better in future.
So kind of you. Thank you. Dr. Fani Veni garu unnara? Yeah.
I'm Dr. Paniveni, consultant family physician, and I thank this Act Now organization and Murthy Garu for recognizing the medical services. It's really very encouraging and inspiring for all the doctors, and we would like to continue this social service to the humanity and mankind. And one more thing I should tell that I'm very happy to receive this award from our Dr. Srinivas sir. He's our guide and mentor. He's actually president of the Academy of Family Physicians of India, and I'm the vice president of this.
Thank you. May I call Dr. Prashant Garu? Prashant Kudichala Prashant Kumar.
Yeah, I'm Dr. Prashant, the pulmonologist working at Malareddy Hospital, Suraram. Thank you, Murthy sir, and thank you, Act Now also.
Thank you, sir. Thank you very much, sir, Prashant Garu. Ushasri, Dr. Ushasri Raula.
Hello everyone, I'm Dr. Ushasri, MD Transfusion Medicine Consultant. Also, I'm practicing functional and regenerative medicine. I really thank the whole team for this award and madam for nominating me. And sir, even I would be available for all your future camps. Thank you.
So kind of you, ma. I'll be in touch with you. Thank you so much. May I call Dr. Sirisha Palichella? Sirisha Garu.
Good morning, dear all. Thank you, Dr. K.S. Murthy sir and Act Now organization for giving a special opportunity for the doctors to get motivated with this awards. This really increases the responsibility for us, and the way the sir request, it is not a request, sir. It's like we are giving an opportunity for many of our friends to get motivated with these awards. Thank you, sir. We keep always available for your service. Thank you, sir.
This is something extraordinary happening here. Everybody is saying we are at your service, anytime call us. But I doubt when I call, who is Murthy? What? Huh? Kindly don't say that. I'll be shocked. Then you have to treat me. Thank you. May I call Dr. Vinod Chahare? వినోద్ గారు ఇంకా ఉమాశంకర్ది కూడా మీరే తీసుకోవాలి.
Murthy Garu and ACNO organization for honoring us with whole medical fraternity. Nowadays we feel like little bit cornered in the society being a doctors, but you are motivating us to keep our services. Thank you very much.
Thank you very much, sir. Dr. Anil Jampani, Medicover Hospitals. Congratulations.
Thank you, Dr. Murthy sir and ACNO team for giving me this opportunity. And this will motivate us and this will give us a great opportunity to achieve further in our field of oncology or in medicine. Thank you so much.
Fantastic. Thank you. Dr. Pranay Kumar Mehta.
I'm Dr. Pranay Kumar Mehta, consultant vascular endovascular surgery. I work in Aster Prime Hospitals and also quite a few hospitals in Hyderabad because we are so few of us. So I would like to thank sir and Act Now for this award, and Abdul Kalam sir is an inspiration to us all. He will be in our thought. Also, service. Abdul Kalam sir and service go hand in hand. So we are, all of us I think, would be open if any kind of voluntary services we can do in collaboration with ACT Now. It will be really nice. Thank you all. Thank you.
Thank you so much, sir. So may I call Nadenla Hazrataya, Dr. Nadenla Hazrataya.
Good morning, everyone. I am Dr. Hazrataya Nadenla, consultant surgical gastroenterologist at Clinicals Global Hospital, Lakadi Kapul. Thank you, Murthy Garu. Thank you, ACNO team and all the delegates on the dais. Thank you for this opportunity. Thank you.
Thank you very much. Please have lunch and go. I request you, don't leave. Have your lunch and go. Thank you.
All of you, please join for group photo.
Wait. That's not important. First, let that thing go on. Dr. Aisha Ahmed.
Good afternoon, everyone. I'm Dr. Aisha Ahmed, working at Global Hospital Lakadi Kapul, and I'm also the medical advisor for my community. Thank you, Murthy sir and Act Now organization for giving an opportunity to be a part of such a celebratory event. We are truly honored. It's a great motivation for we young doctors to work forward and give service to the humanity. Thank you.
Very sweet of you. Thank you. Next to go. Dr. Narsimhu. Fantastic.
Good morning. I am Dr. Narsimhalu, oncologist, working as a assistant professor in Rangaraya Medical College, Kakinada. Thank you, Murthy Garu, for giving this opportunity. And I am very happy to receive this award. And for ACT team also, they are doing good service for doctors motivating like this. And for good academics and future, for scoping of services of all patients, it will be very encouraging to us. Thank you, sir. Thank you so much.
Thank you very much. Next. డాక్టర్ రజనీ గారు.
Garu and Actor Organization. I am Dr. Rajni Gande, consultant gynecologist working in Ankura Hospitals, Kompally. I would like to be a part of your future activities if required. Thank you so much. Thank you so much.
Thanks a lot. Give a big hand to her. Madam. Trivikram, main kada. Please come.
థ్యాంక్ యూ మూర్తి సార్ అండ్ యాక్నో ఆర్గనైజేషన్. నాకు ఇక్కడ ఎవరెవరు ఎన్ని అవార్డ్స్ తీసుకున్నారో నాకు తెలీదు. నా లైఫ్లో అయితే దిస్ మై ఫస్ట్ అవార్డ్. యాక్చువల్లీ హాస్పిటల్స్కి మామూలుగా పేషెంట్స్ పెయిన్తో వస్తారు. సో డాక్టర్స్ ట్రై టు గివ్ హ్యాపీనెస్ టు ద పేషెంట్. బట్ హియర్ అకార్డింగ్ టు మీ మెజారిటీ ఆఫ్ ద డాక్టర్స్ ఆర్ కమింగ్ ఇన్ విత్ పెయిన్ అండ్ యు ఆర్ గివింగ్ అస్ హ్యాపీనెస్. అండ్ ఈ అవార్డ్ మామూలుగా ఇక్కడ అంటే నా లైఫ్లో ఎప్పటికీ గుర్తుండిపోతుంది. బికాస్ మనల్ని ఎవరు గుర్తించరు, మేనేజ్మెంట్ గుర్తించదు, పేషెంట్ గుర్తించాడు, ఎవడో గుర్తించాడు. సో దెర్ ఇస్ వీ ఫీల్ యాజ్ డాక్టర్స్, యంగ్ డాక్టర్స్, అప్రిసియేషన్ ఎక్కడో ల్యాక్ అవుతుంది, ఎక్కడో రికగ్నిషన్ ల్యాక్ అవుతుంది అని మన మనసులో ప్రతి ఒక్క డాక్టర్ మనసులో అది ఉంటుంది. బట్ నిన్నటి నుంచి నాకు హ్యాపీనెస్ స్టార్ట్ అయింది. సో యాక్చువల్లీ ఫర్ అస్ టేకింగ్ అంటే ఇన్ యువర్ లైఫ్ వాట్ యు ఆర్ డూయింగ్, the time what you are giving to this such type of programs and your effort, your strength is never go anywhere. And see, according in my life, if I live for some years, even 30 years, 40 years, I will be remembering you by seeing this award. So by taking this award, we are giving you an award for our lifetime that you have given. We'll remember you. And the next thing, and thank you for giving us happiness. Thank you.
Fantastic. You made my day, Dr. Garu. I'll never forget you. Thank you so much. If you have a business card, give me. We want to keep in touch with you. Thank you. Prithvi Krishna. मेरे अच्छे से
Thank you, Murthy Garu and ACNO organization for giving this award. I'm Dr. Prithvi Krishna, medical gastroenterologist consultant in Kim Sunshine Hospital. Thank you.
Anybody else left? మీరందరూ ఉన్న వాళ్ళందరూ ఇక్కడికి వస్తే ఒక గ్రూప్ ఫోటో తీసుకుందాం. I don't know whether I should say apologies for the delay because it is not because of me, for the doctors' fraternity. Act now, I'll say a few words about our organization. Act now is started by Abdul Kalam's elder brother's son, Dr. Ibrahim, who happens to be the founder chairman of Global Abdul Kalam Foundation. So, on the guidelines of Dr. Ibrahim and Dr. APJ Abdul Kalam, we have established this Act Now NGO some 4 years back. We have some phenomenal achievements on our credit. The first one was conducting 50 mega health camps in 4 years. The significance or the difference is that normally the health camps will be more or less business givers to the conference corporate sectors. You go to some health camp, they will prescribe something and ask you to come to hospital and offer some 20% or 30% discount. We never dealt like that. We conducted health camps in such a fashion that you walk in, all the tests will be done absolutely free of cost. Government and corporate sector hospitals used to participate with equipments, and every medicine is given absolutely free of cost. And minimum footfall will be 1,000 to 1,500. Like that, we have done so far 50 major mega health camps. That is a feather in our cap. Next, we have distributed food to the guest laborers at the time of COVID, around 25,000, and slum dwellers 25,000. That is, every day 300 people were fed by Act Now. And finally, we have donated 6,50,000 worth of wheelchairs to young people of handicapped segment. They are just like us. Just showing pity on them is not going to serve the purpose. So we selected few handicapped youngsters and donated wheelchairs to them, the youth. And around 10 kids were adopted by Act Now, out of which few are doing MBA, few are doing BTech, and few are artists, and one is 3 times national award winner, Dr. Padmavati. This is our achievements. Now coming to doctors fraternity. Even today, in the morning, we have honored around 60 doctors. How we can manage to get such big numbers? Thousands we have honored in the 4 year span, which forget about Telangana, South India, or India. In the world, we are the highest as of now, because somebody wants to break our record. Once again, the COVID should come. In that COVID, he has to cover that number, which is not going to happen within 100 years. At that time, neither you will be there nor I will be there. So as of now, we got that record. Now, doctors fraternity, why I want to be very thankful is, out of these thousands of doctors, not a single one is approached by us. Single one is, including today who are all sitting here, I never approached them. Then how? Some doctor referred the other doctors. That is the phenomenal help I got from the doctors fraternity. Once again, I would like to offer my gratitude to them. Then, why doctors alone? We don't honor any other person in our society. Why so doctors alone? We personally feel that doctors' profession is one of the noblest in the world. Forget about me, the Premier, the Prime Minister of India himself said doctors are angels on earth. I firmly believe that. There may be some other hanky-panky businesses going on around, which field is not doing so. Why alone doctors are targeted as money mongers? It's bullshit. Many newspapers I wrote, many dioceses I given the speech saying that you honor the doctor, one who takes your pain, one who relieves you out of your pain and makes you smile. Not only you, one fellow is sick with a serious diseases. He is relieved means not he himself, but the whole family is saved by the doctor. So it may be sounding exaggerating, unnecessarily enhancing, but end of the day, I relinquish and tell you that doctors are demigods. To hear this, some people get itched, some people get irritated. I care a damn for them, because I have seen at the time of COVID, there was no one to go. Where to go? God won't talk to you, right? But a doctor will certainly. I have seen around 1796 people. The doctors' fraternity has lost their lives. For whom sake? For the fellow human beings. So such a noble profession we selected and we are honoring and we are proud of it what we are doing. Doctors also, they understand our notion. You will be surprised to note in our NGO, majority of the directors are doctors. Majority of chairman, doctor, national vice president and IMA, head secretary. Doc, what is happening here? Bad smell వస్తుంది. Off చేయండి. So the fraternity is having a great regard as far as we are concerned, and we got much help from the fraternity. With these words, I once again take the privilege of inviting you all. You be proud of yourself. You be proud of your from your profession. It's not that every Tom and Dick, Harry can be a doctor. 15 years, 20 years, you might have lost your youngest age, lavish lifestyle, and going on reading. Just like that, nobody will be a doctor. I know. So, with these words, I take the privilege of honoring you all. Give a big hand to your own fraternity doctors and welcome to you all. Finally, you should be very proud. You are honored with such a noble person, Dr. APJ Abdul Kalam. Dr. APJ Abdul Kalam's only one statement I'll give you. I don't need of telling you what is Abdul Kalam, where he has born and what is his history. I don't think any one of you don't know Abdul Kalam. Everyone knows. Only one single phrase which haunts you, which gives you immense impression, that is, dreaming small is a crime. Always go for the highest of the highest. That is the man. And he has invented with collaboration of Somaraju a stunt which has created history by coming down of the economics. 20 lakhs, 10 lakhs, 5 lakhs, lakhsలో ఉన్నదాన్ని ఆయన జస్ట్ 10,000, 20,000లో స్టెంట్ తయారు చేశాడు. I think he is a better doctor. So, with these words, I take this privilege to invite Dr. Ram Babu Garu to very humbly request him to come out to the dais. Give a big hand, please. I ask Dr. Harikumar Garu also to come out to the dais. Please be seated. And Mahindra Tech, a firm with social cause, a human touch to help the fellow human beings. Such organizations, project director and Sri MSB, Sudhir Babu Garu, very humbly request you to come out to the dais, please. Dr. Jaswinder Singh Garu, please come over to the dais, sir. There is one more person has to come, Dr. Ananya. See, she is not a doctor. She is Ananya, Vice President of HDFC Bank. In maximum another 5 minutes or 10 minutes, she'll be with us. The funda is very simple. You need not get to what is going to happen, how long we have to wait. Don't feel like that. It is an inaugural session. Who are all sitting here will speak, motivate you, share their experiences, and after that, awards distribution will be there. Then vote of thanks, I'll take at least 45 minutes to 1.5 hours. You will be pleased. I don't think anybody is pleased with this. So, end of the day, vote of the thanks and having some tea, coffee, snacks, and the program will be over. The idea is very simple, ladies and gentlemen. Honoring doctors motivates them. My humble request, kindly don't speak in the auditorium. Please, if you have any urgent call, please go out and speak. If everybody starts speaking, then my program, no, whatever it is, it is not wrong. You don't know what is the urgency. Anyone can make calls, but kindly go out My humble request to you, kindly go out, speak, and come back and sit. You start speaking here, then these gentlemen, whatever they speak, there is no meaning. With that, may I invite Ram Babu Garu to introduce himself and say a few words.
So let me introduce first myself. I am Dr. Rambabu. I graduated from Kurnool Medical College in the year 1977. Then later on, I worked in the Indian Army for 5 years as Short Service Commission Officer. Then I came out and I did my post-graduation in Usmania Medical College, ENT department, ENT specialty. Later on, I worked in Iran for about 8 years. Later on, when I came back, I joined the Apollo group of hospitals. Jaswinder Singh is my colleague, and we have other colleagues. So, as a ENT specialty, we have seen. You all must be knowing. I mean, I don't know how old. I mean, how when you graduated. I'm talking about when I graduated, ENT was not figuring in any specialties at all. So people were like discarding the ENT specialties. But later on, when I took up, then I became an independent specialist, then worked in the corporate hospital. ENT has gone leaps and bounds, and it is one of the most sought after specialty and most advanced. We have seen the advancements from endoscopic surgeries to micro ear surgeries to the latest interventions in the hearing loss. To just tell you, our branch in Apollo Hospital here, we specialized in doing the cochlear implant surgery. It's like a medical marvel. We do this cochlear implant surgery for the deaf children, totally deaf children or adults also. By this, they can get back their hearing, and especially in children, they get back both hearing as well as the speech. So it makes a wonderful difference for the child as well as the family who are totally discarded before this invention of this surgery, interference of this surgery. They were left on their own to be deaf and dumb, what we used to call them. So doing this surgery, it really gives great a pleasure as well as an excitement, bringing a new life to the whole family. Like it's a game changer for them. So here at Apollo, we have done more than 2,000 operations for the children as well as the adults. And most of the children who were to be discarded on their own now have become they have become doctors, they have become engineers, they have become these IAS, and many of them have succeeded in sports also. So all these achievements are through this particular intervention of the surgery. So this surgery, many people, our colleagues, even the ENT surgeons are also not well aware of it. So I take this stage just to introduce what it is. It is basically it's a electronic device. We put it for the child by doing the surgery. It's a very simple surgery like a mastoid surgery. And once it is done, it is electronically fitted and the child starts hearing again, and it is controlled by computer programming, and they go through some sort of a training which is called as auditory verbal therapy, after which they start learning like a newborn. After being born, after 1 year, how a child starts learning speech, 2 letter words, 3 letter words, 4 letter words, sentences. Just like this child will pass through after the implantation. And within the period of about 1 to 3 years, the child is almost like a normal kid. The only hitch is we have to pick up the children very early, what we call as the early intervention. So our duty is to pick up the children who are deaf. So this awareness has to sink into our medical fraternity, all the medical colleges, all the medical fraternity who are practitioners, especially the pediatricians, the neurologists, where these children are taken initially. So if our fraternity gets aware of this particular issue and which can be
and intervened, as well as the child can be facilitated by getting the surgery done. It makes a real wonder. I invite you to come to our department and see the children, how well they do. You just can't make out whether the child is implanted or a normal child, the way they can speak. So it's like a big life changer for them. So I take this stage to at least apprise you of this particular problem, because we specialize into that and we see still there is lack of awareness amongst our own fraternity. If everybody contributes to this, even if one child can be benefited by this, it is really giving a big gift to him. So I take this opportunity and thank Murthy Garu and the Act Now organization for bringing us, all of us here in the name of felicitating. But it really conveys a good gesture on their part to recognize our services. Thank you very much.
I take this privilege of asking Sudhir Babu, Mahindra Tech Project Director. It's a foundation actually, entitled to be appreciated for the human services they render. With due respect, I call him. Thank you.
So thank you. I'm honored to be invited for this session of the awards. I'm Sudhir. I'm project director of the Tech Mahindra Foundation. It's a CSR wing of Tech Mahindra. Tech Mahindra Limited. I think all of you know that it's IT company in the Mahindra group. So just I'm correlating the words just now Doctor said. Correct, the early intervention. We support a lot of early intervention projects in Hyderabad and 11 cities across India. So today we work with almost 15,000 PWD kids at a various level, including speech and hearing impaired, visual impaired. Few projects we are supporting in LVPI campus and speech and hearing impaired, and including MR and ID and various categories of people what we work with. And I'm glad to know Apollo also is doing such initiative, and really happy to know that. So even though I'm not from medical background, but I'm completely aware of what doctor said, and early intervention is the key for that. And I'm also happy to be part of this event, to see a lot of doctors here, and as a part of our interventions, various areas we get collaborated with a medical fraternity. For example, in the KIMS campus, we run one training center for the youth to make them employable in the paramedical sector. Or we also run our own healthcare academies across India. Other than doctor and nurse, everything we train. So that way, healthcare, we are, as a Tech Mahindra Foundation, we are associated in a bigger way. So coming to the Act Now, it's really happy to see this such initiative is happening. And I came to know, they said, okay, can you be there? I said, I'm honored to be there. And I also recall I think three times I met Dr. APJ Abdul Kalam. I recall his words. Always he used to say, Pura. This is the one thing, all three times when I met him, this is the one thing he told me. Pura is providing urban amenities at rural places. He said this is going to be game changer if this could be implemented in India. So that probably I'm the luckiest person. The three times I could meet him in my service, this one. And coming to my background, of course, as I said, I'm not a doctor, I'm an engineer by profession. I'm a mechanical engineer, done in 95 from Bichkalani campus, and eventually MTech, MBA, and so on, big list of things. But presently with a Tech Mahindra Foundation. And we are one of the, in skill development, as I said, we are one of the biggest CSR-led skill development organization in India today. We work with 20,000 youth across with 11 cities through our CSR funds. Out of that, 40% are them into a paramedical segment. So that's the work what we do. And once again, I thank you for inviting me to be part of it. And also congratulations to all the winners who are going to be receiving the awards. Thank you.
Thank you very much, sir. Uh, Tremendous record, larger than life. But compared to such things, we are too tiny bacteria. But still, we have our own existence. Thank you very much for coming over here and delivering this speech. Now, I would like to call Ananya a financial wizard, I would say. Financial wizard, because uh, we know everything may be second, but money comes first. Paisa hai to Paramatma hai. And she deals with abundant money. Please come up here and say a few words, Ananya. Thank you very much.
Very good afternoon. I feel privileged to be part of this gathering today in this afternoon. All of you are very, very established, honored dignitaries, I would say, that make a mark in this hall today in the right now. And I am actually not even related to the medical field, and I deal in something very hardcore as banking. So that's a very dry subject. So as Mr. Murthy very rightly said, no matter what, everywhere there is a touch of finance. So no vertical for that matter. For example, whether it be medical, whether it be engineering, whether it be banking, nothing in life can be completely seen in isolation. So somewhere or the other, we are all connected. Just like human beings, we are all connected. Similarly, every profession is connected to the other by some invisible dots. And those invisible dots come into play, and when we connect those invisible dots, it is a wholesome progress that the place, the organization, the state, or even for that matter, the country can witness. So yes, that way my presence today afternoon is a bit of, it does hold a bit of relevance. I'm from the banking industry. I'm a vice president and cluster head of HDFC Bank. I have 50 branches reporting into me for everything. I mean, whether it is retail branch banking, it is internal audit, it is compliance, it is process. So basically, these 50 branches, I am responsible for their overall hygiene parameters as well as business development. So that is a little about me. I'm basically a Bengali from Calcutta, here in Hyderabad for the last 11, 12 years now. The city has been extremely kind, extremely warm towards all outsiders who were outsiders like me once upon a time. I consider myself a Hyderabadi now in 11 years' time. So, primary responsibility for me to feel this way, I feel it's the warmth of the people. It's the capability of Hyderabadis to make everybody feel its own. So, kudos to that, for that, I mean, to the city. Now, coming to this organization, if we wouldn't have had organizations like these, I don't think the city, or for example, the state also, would have progressed to the extent it has progressed. You see the kind of infrastructure this city has, whether it be road infrastructure, whether it be communication, whether it be medical. So people across the world are now traveling to Hyderabad for their medical requirements, which is a matter of great prestige. Just to put it in perspective, you know, my own mother, she's a cancer survivor. She had cancer in way back in 2007, wherein, you know, she got surgery done and she's doing better now. And she got her parathyroid gland operated. So parathyroid hormone, which, you know, she was mimicking all the symptoms of Parkinson's. So her whole body was shaking, you know, for 3 years, and there was no diagnosis. And we were so concerned because she was just becoming, I mean, worse to worse. There was no improvement at all. For 3 years, she was on Parkinson's medicines. And it is only here that, in Hyderabad once again, that she got diagnosed that this is not anything to do with Parkinson's at all. It is something to do called parathyroid gland, which is just, behind the thyroid gland. So I, being a banker, I mean, for me it was something so new, and it was a surgery, after which she became completely fine. It was just like a switch on, switch off thing. And it was such an eye opener for us. In fact, I felt quite ashamed that, being from the city where my roots are, she was under wrong diagnosis for last 3 years. So this is the kind of potential that this city holds. And I'm so proud to call myself a Hyderabadi now because of the infrastructural development, the facilities, and the kind of brains that we have in Hyderabad. The doctors, I mean, how do I say, my heartfelt respect to each one of you in this room, including doctors and including all the people who are making these facilities available to people like us who are not at all well known in the field of medical. So, it's laymen like us, we feel very vulnerable, we feel so helpless. So, it is for us, the medical field, the doctors, and even the faculty who's associated with the medical field, they're like gods to us. So yes, thank you, and once again, thanks for having me here, Mr. Murthy, Mr. Dr. Hari. It's absolutely a privilege, and my best wishes to the organization, and many best wishes for the birth anniversary celebrations. Thank you.
Now, I ask Dr. Jashwinder Garu to say a few words.
Thank you, sir. Good evening, everyone. I thank Murthy Garu and ACNO Foundation to have given us the opportunity to come here and get awarded. I want to begin with, as sir was telling about moral booster for the doctors, these awards. Thing is, I'll start my journey when I started thinking about being a doctor, and it was in 8th standard when I thought that I'd become a doctor. And the journey has been really cumbersome and hardworking for us. And not only me, my family. I come from a business family background, and I was the only son in the family who had thought about being a doctor. So my journey has been since then, and as I said, it takes a lot of hard work, dedication, passion to really, see your dreams come true. And then, of course, a lot of my cousins and everybody, it was difficult for me to earn for myself also, for my family also initially. But I know that one day I'll make it, and that's how, my dreams had come true. And I am a ENT surgeon. I work at Apollo Hospital with Dr. Ram Babu and Dr. Vinay Kumar. And sir has given a briefing about the department we have. Just want to talk about ENT. ENT, when I joined, it was like not a glamorous subject to take. But down the line, it has progressed a lot. Now we have so much of scope, so much of subspecialties coming into ENT. Now we have otology, rhinology, laryngology. It's just expanding, and youngsters are coming forward to take up the field and just flourish and take it to leaps and bounds. So that's the ENT briefing I can give you about. And I thank Dr. Garu, Dr. Murthy Garu, to have invited us to give a talk here and get honored this thing. And thank you so much, everyone. Thank you.
Thank you, sir. Actually, Dr. Ram Babu Garu said getting an award here is very prestige, but it
Thank you, sir. Thank you so much.
Hold like that. Close your eyes with smileful face. Just hold the breath for 10 seconds. 1, 2. You can locate the location of the mind. Mind mastery is life mastery. Hold the breath. 4, 5, 6. Okay, remove. Otherwise it will come in the paper. What thought you got during this? Manasu daily produces more than 56,000 thoughts. But when you are holding the breath, only one thought is prevailing. If I won't remove, I'll be in heaven. Big round of applause. All doctors will go only to the heaven, not to the hell. Big round of applause. Next. Yes, one, please. Now finally, breath and mind are interlinked. Last 1 minute. We are all the saviors. We all know mental health is the root, physical well-being is the fruit. As sir said, yes, keep your hands like this. Fifth one, this is one cycle. Please do for 9 cycles with closed eyes, having smile on your face. No income tax paying face. Close your eyes. 4 times short breaths. 5th long breaths. All of us, let us do for the sake of welfare of medical fraternity. 4 times short breaths. 5th long breaths. Yes, sound has to come. You are all doing very well. Last 30 seconds for our own health. Repeat. Yes, 7 cycles over. Last 2 cycles. Breath mastery is life mastery. Breath connects body, mind and soul. Breath is the bridge. Now, keep hands in namaskaram position. Take long breaths. Only long breaths. Long breaths for long life. Breath oxygenizes the tissues. Long breathings as if whole body is breathing. From head to toe, you are breathing, making every cell more oxygenized. Last few long breaths for our longevity. As an anti-aging specialist, every adulterated adult has to become like a child. Long breathings, belly breathings. Now slow breathings, normal, natural, easy, soft breathings. No sound, just witness. As Buddha said, just witness your breaths. As you are witnessing the breath, the smile on your face increasing, spreading all over the face. Normal, natural, easy, soft breath observation. Spreading all over the body. Every cell is soulfully smiling. Spread into high-techs, Abdul Kalam award event auditorium. Spread into Madhapur. Whole Telangana is soulfully smiling because of our act now. Spread the smiles all over the globe. All nations are looking towards India because of this positivity. Spread the smiles, bless your body from this state of consciousness. Bless all the COVID warriors who left their body for the sake of society in their duty. Spread the soulful smiles, bless them. As you are spreading the soulful smiles, you are becoming much lighter, lighter and lighter. Be in that state for 5 seconds. Now you can see Abdul Kalam in front of us. You can feel that eyes, glowing eyes, innocent, wise. Abdul Kalam ji in front of us, blessing us with power, positivity, peace, profound bliss. Say thanks to Abdul Kalam. Congratulations to all the awardees. Slowly, slowly, keep palms over your eyes. Slowly, slowly, open your eyes with smiling face. 5, 4, 3, 1, 0. Big round of applause to Act Now. How many of you like this? Yes. If you practice this, we'll have profound mental health. If you prescribe these to patients, they will have physical health as well as mental health. Then we can become Vaidyo Narayano Harihi. Thank you very much.
Thank you, Dr. Hari. Vaidyo Narayano Hari. This is a good statement. But nowadays people are saying Vaidyo Narayano Hari. Why it is happening? It has to be self-analyzed by your own fraternity. Now, the much awaited Doctors Awards distribution will take place. Thank you to all the dignitaries and particularly Hari and Ananya, Sudhir Babu Garu, Dr. Ram Babu Garu and Jashwinder Garu. And Dr. Ram Babu and Jashwinder are seen here. Behind the scene is Dr. Shrikant, audiologist. Rise once, please. He was the man literally behind me. That sir is so worthy. He himself is an audiologist and he has been awarded, honored by ACNO, one of the nicest human being. Thanks for being here, Srikant Garu. Thank you. Now, first one, may I call Dr. Deepak Kumar Saha. Shankar, లేకపోతే ఇట్లాగే చేసేద్దాం.
Thank you very much, first of all, to the organization Act Now for calling me over here. I was not aware of a function like this. Dr. K.S. Murthy called me and through some reference, I don't know, but one gynecologist had referred my name. It is indeed a big pleasure, privilege and honor to receive this award in the name of the great person who perhaps in the world everyone knows him, and I'm very thankful and honored that an award in his name is being bestowed on us. Thank you very much. Thank you all the dignitaries over here who had come here and award us with this prestigious award. It is very important for